We know that there's a rising incidence of type 1 diabetes in youth, but there are also some complications that are of great concern. So a session put together by Evgenya Patrakeeva and Dabelea, and we're pleased to have them both with us, explored some of these issues. So let's start with you, Dana. Tell me, what were the main concerns that were discussed today in your sessions?
So the title of our session today was Type 1 Diabetes in Youth, Are We Making Progress? And I think that I'm sorry to say that maybe with one exception, one of the presentations showing better glucose control in kids with type 1 diabetes, most of the others, instead of suggesting progress, suggested that actually things might be getting worse, which is worrisome, of course. For example, there were 2 presentations from the United States showing that after 2010, there is an increase in the risk of kids with type 1 presenting in diabetic ketoacidosis, which is an acute complication of diabetes accompanied by long-term consequences. So that's worrisome, especially because these are the first data suggesting that this is happening, and we don't know why. What's changing that predisposes kids to present in such an acute way?
So it's not just a question of rising numbers. There's something fundamental going on elsewhere.
Not a question of rising numbers. It's a question of is the disease becoming more aggressive? Is it diagnosed at the later stage in the preclinical evolution of the disease? And what factors in the family, in the communities, in the healthcare systems that exist out there, especially in the United States, might allow for that to happen?
Evgenya, what did you take from that?
The next question is what we need to do to prevent it. The main questions, because we really still have a place for improvement here. So not only thinking about physiological process or some factors or something like this, but we really need to do something now because it's dangerous for our patients.
And what did you come to the conclusion? What were the main things that you thought needed to be done?
With respect to this particular topic, given that this rise is mostly seen now in the United States after 2010, one of the remaining questions is this due to the recent recession in the United States? Is this due to changes in the healthcare system over there? Or what are the factors that are responsible for this rise? Because before we know them, unless we know them, we can't intervene.
And are you seeing that situation mirrored in any other countries?
We are seeing that, in fact, DKA at onset of diabetes is not decreasing in the majority of countries in Europe. It might be increasing in a few countries, but for sure it's not decreasing. And going back to the United States, we are actually also seeing a resurgence of chronic diabetes-related complications in adults in the United States after 2010. So something is happening in the United States more recently that allows for these things to happen.
Evgenya,
I just want to add something to be more positive, because
yes, I was just going to say, tell us something else to depress us.
Worse and worse. But we have a really nice presentation from Poland. With great results. About structured education, about increasing level for, I don't know how to say, pumps and sensors and technology for the children and young adults. And what is interesting, they changed the time for being adults. It's 26 years, they said. So everything is better in their country because they really do a lot about education, about care of patients with diabetes. So I think maybe for us it's the best choice just to do something like that.
And in some ways, for people diagnosed in their, particularly in late childhood, social media is an extraordinary way to keep people together. And, we see the kind of apps that we have for exercise and all those kind of things where there's a group effect in getting people to improve behaviours. And perhaps we're not exploiting those enough in youth.
Absolutely. I think that's one of potential avenues for powerful interventions.
Perhaps because we're not so good at social media
Right.
as they are. I mean,
probably more after type 1 diabetes is diagnosed than before, but definitely. And there are many, many programs that are starting to use technology and apps to deliver interventions.
There was one other, what was the other depressing presentation that you had?
Well, I mean, I don't know that they were depressing.
It's possible to say just depressive,
yeah.
but it's like not.
Yeah, no. Another interesting presentation was a study from Canada that looked at a dietary intervention, a gluten-free dietary intervention in individuals diagnosed with both type 1 diabetes and celiac disease. So a gluten-free diet is the treatment for celiac disease, but the question was, would such a diet improve glucose control? And perhaps surprisingly, the answer was no, it does not. Now, individuals with celiac disease will have to consume a gluten-free diet, but that diet will not improve their glycemic control, so something else must be done than another behavioral intervention.
Nevertheless, though, it's very important to have those negative results.
Absolutely.
As well as the positive results. I'm very firmly of the opinion that actually if we're always only doing positive results...
That's the only way to learn.
Yeah. So let's stop being depressed about this. If you had a message for clinicians after your session, what would it be?
Well, going back to these studies about diabetic ketoacidosis at onset of diabetes, I would suggest that both clinicians and families, especially families that already have a member with type 1 diabetes or a sibling, they need to be aware that their family, their children are at risk for type 1 diabetes. And if they can recognize the signs and symptoms of type 1 diabetes early enough and approach the healthcare system, go see a provider, such an onset, such an acute and dangerous onset might be prevented. So both clinicians and families be aware and recognize symptoms of type 1 diabetes in your patients. That's especially difficult in younger children who not always know how to express their symptoms verbally. But knowledge, anticipation is always needed.
Evgenya, any advice that you have for clinicians?
Yeah, I totally agree. I just need to add that because of age differences, we also need to educate our pediatricians who work with such group of children who are less than 2 years old or less than 5 years old. And awareness of the disease and early diagnosis, it's an issue. Yeah.
Yes, we shouldn't forget that it's not just about educating families, it's also about educating the frontline medical workforce to better recognize these things.
And providing health care for everybody.
Yeah. Yes.
True.
Sorry, that was Mr. Trump, if you're watching, healthcare for everyone, please. Hugely important in prevention of diabetic complications. Thank you. That's the end of that announcement. And thank you both for coming along.